Everyone should also walk away with a safety book. We talked the same thing as last year. Keep track of your records. This is a personal document to yourself. If you guys are in the foreman elite position, you guys get people working under you. You got someone working on the top step of the ladder. Tell them to get down, document it. If they come back the next week and they're doing the same thing and they fall and break their shoulder, you got documentation for yourself that documented it. It's for your protection as well. Okay. So grab one of these. Plus, you can keep your hours in it, where you're working, what type of environment that you guys are working in. So good record. Want you to use it. Just don't take it, but use it. Track your hours and your time, your job ticket, your job number, where you're at. So everyone, make sure you grab one of these as well. Okay. Just one more thing here. Those guys who are working on doing service work, just make sure. I was asked to ask you guys to make sure you guys do write good documentation on your 3 parts, noting what you're doing. Not only if you guys are filling them out on contracts for whatever T&M jobs or extra, make sure you document what you're doing on your paperwork so that when you turn it in the office, when the customer asks, hey, you're sending me a bill for $3,000, what they do, we can say that they can look it up and say, yeah, you did this, this, and this on this day. So it does help us in the office to know what you guys are doing out in the field. So, with that said, we've asked Janelle to be with us today. I'm sorry, I couldn't remember your last name.
That's okay.
Yeah. Really a great. She does a great job. She was a cardiac arrest nurse. Right?
I was a stroke nurse. I was a neuroscience nurse for 25 years, and I've been a stroke coordinator at OSF for 18 years. Just retired 2 years ago, and so now I'm working part-time at this organization called the United Stroke Alliance, which is all about death prevention, awareness, and recovery for stroke. So that's my background.
Each one of you guys should have one of these. You can take it home with you. This is her presentation. But it's something that we should all take care of ourselves, especially you young guys. You guys aren't going to be young forever. You have to retire at some point, and we want you to enjoy your retirement. But you have to take care of your body and know what's wrong with it when time comes. We've had a member of our crew, Brian Welker. Brian has just, he's come back from a heart attack, and he's done. So, Brian, you got anything to say, brother? Take care of yourself. We've had, I know some of you guys, Tuesday we've had a death in our past fellow brother, Ronnie Wilson, passed of a heart attack, massive heart attack. He just died Tuesday. A good friend of ours and worked with us for a number of years here at Oberlander Electric. Heart disease does run in my family. I take high blood pressure. My dad died the day he retired, early retirement of a massive heart attack. So it does get really close to me. I think this is really important for all of us to know about. That's why we're having this class, so that you guys are aware of everything that has to do with your heart and stroke awareness. So it's a really good class. And if you guys got any questions, free to ask Jan. So, Jan, I'm going to give it to you.
All right.
Thank you for coming very much.
Yes, thank you. My disclosure is I'm a neuro nurse, so I don't know as much about heart and heart attack as I do stroke. But being a nurse, I had to know a little bit. So we're going to start out with heart attack, since that's kind of close to you guys because of the person that in your organization that has had a heart attack. So a heart attack basically is the sudden blood flow to the heart is blocked. For some reason, the heart is not getting the blood supply that it needs, it's usually from a rupture of plaque. So because we don't eat healthy, plaque can build up in our vessels, and that can cause the stroke or the heart attack to happen. So that plaque breaks off and blocks off the blood vessel. That is different than sudden cardiac arrest. So sudden cardiac arrest is actually when the heart stops beating. All right, so a heart attack is when the blood flow is blocked and the heart's not getting it and damage is occurring. Cardiac arrest is actually when the heart stops beating. So that's the difference. The American Heart Association, just some facts. Unfortunately, very few people are aware of the signs of heart attack, and even less are aware of the signs of stroke, and we'll go over that later. But only 50% of adults are aware of all major symptoms, but they knew to call 911 if somebody was having a heart attack, so that's good. Someone in the United States has a heart attack every 40 seconds. All right? That's also, we'll talk about stroke. Every 40 seconds someone has stroke. So you think about if you're with someone for 8 hours a day, the likelihood that you might witness someone having a heart attack or stroke is very likely. Every 34 seconds someone dies of cardiovascular disease. Over the past decade, males were nearly twice as likely as females to die of heart disease. All right, so I don't see a whole lot of females in here. So you guys are the majority there. And heart disease is the #1 cause of death in the United States, all right? So it can happen to anyone, at any age, at any time, all right? So that's very important information to know. So the biggest thing is with any of these types of things is don't ignore the symptoms. All of us are very, very good at saying, oh, it's just an indigestion. Oh, it's, I'm okay, I'll be fine. But if someone is having chest pain or discomfort in their chest, a lot of times they'll say it feels like a squeezing, tightness in their chest. I've heard people even say that it feels like an elephant sitting on my chest. It's just this pressure that doesn't go away with rest. That is a sign of a heart attack. They can also be feeling weak, lightheaded, faint, along with that pressure in their chest, shortness of breath. They can become nauseated. Sometimes they'll vomit. They can have pain or discomfort in their jaw, neck, or one or both arms. And they can have these signs sometimes days or weeks before they ever have a full-blown heart attack. All right, so those symptoms can come and go. But the biggest thing is to recognize those. And if someone is having those, the best thing that you can do is to get them help by calling 911. Heart attack signs in women are a little bit different. They can also have some chest pain, but a lot of times they will have pain in their shoulder or their arm. So it's a little bit different pain. They will have the shortness of breath, the nausea, vomiting, dizziness, fatigue, and sweating. So, but their pain is not always in their chest. So if they're complaining of shoulder pain, arm pain, again, that doesn't go away with rest. That could be a sign of a heart attack. You can have a heart attack and not even know it, not even be aware of it. It's known as a silent myocardial infarction. It can account for about 45% of heart attacks and strike men more than women. These are often mild and brief, but if you have them, you still need to seek medical attention. Go to a prompt care, go to a doctor. So any of those discomfort in the chest that lasts several minutes or goes away or comes back, it's kind of a warning sign. It's warning that something's going on. So discomfort in the upper body, shortness of breath, any of those things, breaking out a cold sweat. If you have those symptoms, doesn't feel right, get help. Go to a physician, a prompt care, call 911, just get help. One of the biggest things I want you to know is if you have a heart attack a stroke, don't try to drive yourself to the hospital, all right? There's so many people that do that. Call 911. One of the reasons is, first of all, you don't want to be driving yourself or driving someone to the hospital if they're having a heart attack, because if things go south, you have nothing to do. I mean, there's nothing that you can do. If you call 911, you're going to have medical help there right away. There's going to be somebody there that's going to be able to check their blood pressure, give them oxygen if they need it, do all of these things. But the most important thing with calling 911 that a lot of people don't know is the fact that when you call 911 for a heart attack or a stroke, at most major hospitals, Peoria is one of them, if you call 911, they pre-hospital notify when they're coming in with a stroke or a heart attack patient, all right? So they can be on the scene notifying the hospital, they even have an opportunity to send EKGs and medical information to the hospitals before they ever get there. Once they pre-notify the hospital, you've got that team of surgeons, doctors, medications, pharmacists, everybody that's standing by ready to treat that patient, all right? When I was in the emergency room with stroke, when we would get a stroke alert, we would be down there, we'd have the medication ready, the CT scan was cleared, the docs were down there, everybody was there. We were actually able to treat people in 5 minutes. So, and that's really good when you're talking about tissue that's dying. So always call 911. Okay, don't try to drive yourself, don't try to drive someone else, because it does speed up treatment. With heart attack, one of the things that you can do while you're waiting for EMS to arrive is to give them aspirin. Aspirin is indicated in heart attack, so give it as quickly as possible for the best result. They need to chew it, a 325 milligram aspirin. Don't use an enteric-coated aspirin because the enteric coating on that doesn't allow it to dissolve and get into your system fast enough, so it needs to be a 325 milligram just regular aspirin. If the person has heart problems and they have nitroglycerin on board, you can give that, but most of the time, most people don't have that, so you just, 911 can give that, or the paramedics can give that when they get there. It's not as emergent. It's more beneficial to give the aspirin first than worrying about the nitroglycerin, so that can be given. Have a lie down and rest, and if you're having a heart attack and you're alone, call someone, all right? Make sure that you've got somebody that can come over. If you're alone and at home, make sure that your doors are unlocked so the paramedics can get in. So those types of things are very important. Cardiac arrest, we talked about that, is caused when the heart's electrical system malfunctions and it stops beating properly. So it is arrested or stopped. It can be reversed with CPR. So it's important that you know CPR and how to get that chest compressions and get the heart started again. So.
How do you guys know CPR first aid? It's a good thing to know. You could say, usually the one you're going to save is probably someone at your home. You're going to be given CPR first aid. Can't happen on a job. We didn't have to give Brian CPR. We were lucky enough. We made it to the emergency response first. We made it to the prompt care within 2 minutes of his heart attack. So just really, really lucky. But for you, those of you guys that aren't certified, we do have the classes, and they are usually posted on the union website when those classes are going to be conducted at the apprenticeship. They're supposed to last, it could last between 2 to 4 hours, depending on how many students are involved, but it's a good class to refresh yourself, and you just might save someone's life, maybe one of your loved ones or a fellow colleague or worker that you guys are working with. So if you can, at some point, they are going to have these classes at the apprenticeship. You know, it doesn't take long, but it's a great thing to be trained on again.
The other thing I would recommend is know where the defibrillators are in your organization if you have defibrillators.
We have one defibrillator here at the shop, and it pretty much that training as well is done when we do CPR first aid training. But they pretty much walk you through it. All you got to do is open it up, and it will walk you through how to apply that defibrillator to the patient.
Yep.
Super nice. Just bought a brand new one, actually.
Nice.
The last one, the battery died.
And like he said, it is very important because time is tissue, all right? Time matters. For every minute that you waste, heart muscle is dying, all right? So it's so important to act quickly, get help, and you know, give the aspirin, call 911, get all of that stuff going. More than 90% of people survive a heart attack, which is very good, all right? It is still the #1 cause of death, but a lot of people do survive heart attacks. Surviving is primarily due to recognizing the symptoms, getting prompt treatment, and also prevention, all right? So nobody likes to talk about prevention, but it is very, very important. Prevention, stroke and heart attack, the prevention is the same, and I'm going to go over that. So they're very similar. Stroke and heart attack have a lot of similarities other than their symptoms, but it is a medical emergency. It is tissue that is dying, and it's very, very important to react and act quickly and know what to do. So a stroke is actually a sudden brain damage or disruption of blood flow, not to the heart, but to the brain, all right? Me being a neuro nurse, I think the brain is much more important, but you know, we need both of them. So, but there's two types of strokes, all right? One of them is called an ischemic stroke, which is the most common type of stroke. About 87% of strokes are ischemic. So that is when a blood vessel gets blocked by a clot coming from someplace else in your body, or plaque that can rupture and then block a blood vessel. The other type of stroke, which is not as common, but it is more life-threatening, fatal, is called a hemorrhagic stroke. And a hemorrhagic stroke is a bleeding type stroke. And that just means, hemorrhage means to bleed. That means that that vessel, for some reason, has ruptured, all right? Some of you may have heard of an aneurysm. Some have had an aneurysm. That's a weakening on the blood vessel that outpouches, and it fills with blood, and then it gets thinner and thinner, and it ruptures. A lot of times from long-standing hypertension, those vessels can get weak, and they can rupture, causing a hemorrhage in the brain. So there's two types of strokes, all right? And that's important to know when we're talking about prevention or with treatment. Do you guys have any questions so far? I forgot to tell you, I'm pretty laid back, and if you have questions or if I haven't explained something, please just ask me. Like I said, I kind of go through this kind of fast, and I just figure everybody knows what they know, and if they don't, they'll ask. So please ask questions. So we talked about heart attack. How many people were aware of the heart attack signs and symptoms? Stroke is not quite as, people don't know as much about stroke as they do heart attack. Only about 38% of adults, so that's maybe 1 in 3 or 4 people, can recognize all 5 of the warning signs and know to call 911. All right, so there's a lot of education that needs to be done, and I really commend your organization for putting this stuff together because this is really important. Just like with heart attack, every 40 seconds someone suffers a stroke. So if you're not seeing somebody with a heart attack, you might see somebody who's having a stroke, all right? Every 4 minutes, just like with heart attack, someone dies of a stroke. Almost 30% of people younger than 45 in the United States know the 5 most common stroke symptoms. You guys are all pretty young, so that means that you're in that group that don't know all of those signs and symptoms. It is the number 5 cause of death, all right? So not quite as fatal as a heart attack, but it is the number 1 cause of adult disability, all right? So if I know in the emergency room when we were talking about stroke and we were talking about treatments and the complications or the risks or whatever, they would look at us and say, I don't care what you do, just don't leave me disabled. So people would rather be dead than disabled. So, it is the number 1 cause of adult disability.
Dan, my father-in-law had a couple strokes a couple years ago, and the only reason I'm asking this question is there's a time frame that he got this, I'll call it a miracle drug, because he was very rigid, locked up, and they said he was within the time frame to get this drug that took him out of the frozen kind of mode he was in at that moment. What is that time frame that we need to get somebody to suffer for medical attention?
The time frame is as quickly as possible. And I'll talk a little bit more about that. It used to be that there was a 3-hour window for what we call the TPA or the clot busting drug. It was 3-hour window. That has been extended. Now with additional data and studies, they have shown that can sometimes be given even outside of that 3-hour window. There are also treatments that can be done endovascularly, just like with a heart attack, where when they treat a heart attack, they will go up and pull the clot from the heart or fix the heart endovascularly. They can also do that with the brain. So they actually have neurointerventional surgeons that can go up and pull the clot out of the brain. And that can be done probably within, now they're doing it even out 24 hours from the stroke if they're a candidate. So the biggest thing is just like with stroke and heart attack, time is tissue. I mean, for every minute that you wait, that tissue is dying. So the faster you can get there, the faster they can do the treatments and the better the outcomes are. So that's what they talk about, that time window. It used to be that it was a 3-hour window, a 6-hour window, but now they're extending that. So there are things that can be done even later. So it's very, very important to get them to a hospital that can treat stroke as quickly as possible.
Do paramedics carry that TDA? Can they administer that, or is that something only the hospital would use?
That's a very good question, Jeremy. No.
Can you repeat that?
So we asked if paramedics can administer, is it TDA, is that what you said? TDA. Or if it's only at the hospital?
It can only be given at the hospital. The paramedics don't carry that. It can also be used for heart attack as well. There's a drug for heart attack. But no, the paramedics do not carry that because there is a risk with that. It's a blood thinning drug, so the blood pressure has to be at a certain parameter. They have to be watched, and so it can only be administered in the hospital. That is not something that paramedics can give. So, any other questions? These are really good questions. Nope. Okay. So with the brain, it's all about location. So the heart has a couple of chambers. The brain has many, many areas in it that allow you to do things. I do this presentation for 5th grade students, and I always ask them, what does your brain do? Why do you care about your brain? And it's because everything that we do every day is all about our brain. And there's different lobes of the brain. So these colored pictures here kind of show I call it the real estate of the brain. So depending on where your stroke happens, that's what kind of disability or problems or symptoms that you'll show based on where it happens in the brain. So the yellow area is your frontal lobe. That's your personality, your emotions, your area where your speech, motor area of your speech is located. So those types, if the stroke is happening in that area, you could have problems articulating words, making the right words come out, talking. You could have problems with your emotions, your behavior, your thoughts. The pink area is your parietal area. Oh, also in that frontal area, you can see the yellow line that kind of comes down right before the pink area. That's your motor strip. All right, so that's the area of your brain that controls how you move your body, like one side of your body, how you move your arm, your leg. That's your motor strip. On the parietal, the pink area, that little line that goes down pink right next to the gold, that's your sensory area. So that's your sensory strip. So that's how you feel things, whether you have numbness or tingling or can feel your arms or your legs. That also has your reading and comprehension area there. So a lot of people that have strokes aren't able to read. They can't write. They may not be able to understand speech because we don't just speak language. We also understand it, so that's your sensory area. The occipital lobe in the back, that's back here. That's your balance, your coordination, sometimes your visual. The green area is your temporal lobe. And that is also has some speech center in it there as well.
It's not only just, everyone says your leg goes numb, your face droops. That's just one part of it. It's also all these other things that go along with that as well.
Absolutely, and it depends on where that damage is happening at the time, what kind of symptoms usually that you'll see, or what kind of disabilities. So this slide here, so strokes can happen to anyone at any age, at any time. And I said it's the fifth leading cause of death, but it's the #1 cause of disability. So I'm going to ask you, you're going to think I'm crazy, but how many of you brushed your own teeth this morning? How many of you drove your car to work? All right. How many of you went to the bathroom by yourself? Didn't need help? How many of you could read? Write a note. All right. Dress yourself. It seems crazy, but these are the type of things that people with stroke are left with. The types of disabilities are the everyday things that we do, our everyday activities of daily living. Time lost, I said was tissue loss, but time lost is brain loss. All right. 1.9 million brain cells are dying every single minute during a stroke. You're born with 100 billion. Unfortunately, we lose a few, sometimes on the weekends we burn off a few brain cells, or as we get older, those brain cells don't last. But during a stroke, 2 million brain cells are dying every single minute. All right, so again, it's important to be a lifesaver, to know the signs and symptoms of stroke, to know the signs and symptoms of heart attack, to know what to do. So stroke has some different symptoms than heart attack, and again, that depends on the location in the brain. So learning the signs and symptoms of stroke, it can sometimes be difficult. At the United Stroke Alliance, we have an app, and I'll pass this around. You can actually, there's a QR code. You can actually download this app on your phone. And I have it on my phone. I'll just pass it around. If you guys want to download it, just put your phone up to the QR code, and it will...
Oh, we got it. They're all on the...
Oh, on that, okay,
Yep.
okay, don't have to worry about it then, cool. But these signs, any one of these, it doesn't have to be all of these, any one of these could be mean that person is having a stroke. So be faster is how we have determined it's an acronym to help people remember the signs and symptoms of stroke. So B is balance. All right, if someone's having trouble with their balance, they may be falling, leaning to one side, not being able to sit up straight in a chair. They can have trouble with their balance. They can be, sometimes they'll even say that they feel off balance, they feel dizzy. All right, they can complain of dizziness. So B is balance. E is eyes. They can have trouble with their vision. And these usually come on suddenly. So they can have trouble with their vision. They can have trouble seeing. Sometimes they'll complain that all of a sudden their vision is blurry. It's double. Many times they'll say that it's like a shade's come down. They can only see part of something, like part of, I'm looking at you and I can only see your feet. Or I'm looking here and I can only see this side of the room. I can't see anything on this side. So they can have trouble with their vision, with their eyes. F is for face. If you think someone's having a stroke happens on one side of the body. If it's on the right side of the brain, it affects the left side of the body, vice versa. So they can have trouble with weakness of their face. So if you think somebody's having a stroke, you can ask them to smile. And usually when we smile, both sides of our face go up. If they're having a stroke, one side of their face may droop down. They'll have a droopy face. So you can ask them to smile, see if their face is symmetrical. A is for arms. You can have them raise their arms, put their palms in the air, kind of watch for 5 or 10 seconds and just see. If there's any weakness, even if it's subtle, you'll see their arm will kind of turn in or the thumb will kind of move down. A lot of times they can raise one arm, but they can't get this arm up, or they can get it up, but it won't stay up. So they can have weakness on one side of the body. S is for speech. They can have trouble with their speech. So expressing speech, they can have trouble with getting the right words to come out. Sometimes if you're talking and you're like, you know what you want to say, but the word just won't kind of come out, that's how they present. They'll be trying to talk and they'll be trying to say something, but the word won't come out. Or they'll be talking to you and the wrong words come out. They'll be saying something and the words don't make sense. Many times they can have trouble pronouncing words. So like dysarthric, kind of like when you have a big mouthful of peanut butter or a marshmallow and you're trying to talk and you can't pronounce your words very well. It sounds like that, all right? So they can have trouble with their speech. But we don't just speak language, we also understand it. So there can be damage to the part of the brain that is understanding speech, where you may be talking to them and asking them what's wrong, raise your arms, do this. They are not understanding what you're saying because that part of the brain is not working. So they will look at you like they're confused, like they're scared, because they are not understanding language. It's like you're speaking a foreign language to them. They have no idea what you're saying because they're not able to receive that language. All right? T is for time. 2 million brain cells are dying every single minute. You need to get emergency response by calling 911 and getting them to a hospital. So any one of these, learn these signs because any one of these could be a stroke. All right?
What's the youngest that someone's had a stroke at? You know.
I'm trying to think. A 12-year-old girl, she actually had a dissection from gymnastics, and she had a stroke. I just had a... She did pretty well. We saw her in the acute phase, and then she went to the peds group. I did just have a student that went through my 5th grade education class that recognized his classmate who was in the 6th grade that was having signs and symptoms of stroke, and he was able to recognize that and get him help, and the student, they got him to the hospital, and he's doing well. So it can happen to anybody at any age, at any time, just like a heart attack. So it's real important to know these signs. So download that Be Faster app, because when you're in this situation and you are trying to remember the Be Faster, it's hard. You know, you can also, on this app, you can click on the B and it will tell you kind of what to look for. So it'll kind of walk you through those symptoms if you're not sure. So it's nice to have that life-saving information at your fingertips. All right, did that not change? All right, so transient ischemic attack. So we talked about the silent heart attacks, strokes. These are not silent. A transient ischemic attack is these signs and symptoms of stroke that you have, but they go away. All right, so it's a temporary blockage of the blood vessel to the brain, and because the symptoms may only last for a few minutes, people don't take them seriously. All right, so these symptoms, if you have them and they go away, is basically, a lot of people ignore them. This is a big mistake because a lot of people that have transient ischemic attacks will go on to have full-blown strokes within a few days. So it's very, very important to recognize the symptoms. I call it the check engine light in your brain coming on. It's kind of like when your check engine light in your car comes on and you're like, oh my gosh, something's going on. That's what's going on in your brain, is those symptoms are coming and going because maybe the blood is still being able to get there, but it's not getting there the way it's supposed to, or it's blocking. But these symptoms, if you have them and they go away, they can be very, very serious if you don't get them checked out. So always pay attention to that check engine light in your body going off, and make sure that you get some help. So with a stroke, what do you do if somebody's having a stroke? Like with a heart attack, you want to give them aspirin, all right? Stroke, aspirin is not indicated in stroke. And the reason why is because there's those two types of strokes. Even though ischemic stroke with the clot is the most common, there's also that hemorrhagic type of stroke. And if you give an aspirin for somebody that's bleeding, you're going to make that bleeding worse. All right, so we don't give aspirin for stroke. It is not an emergent treatment. Sometimes they will give aspirin after the stroke to prevent another stroke, but don't give it during the acute phase until they've had a CT scan to determine whether it's a bleeding type stroke. The best thing, the most important thing that you can do for stroke is call 911, all right, immediately. Like I said, EMS, pre-hospital notification, it speeds up treatment. We can have that hot busting medication ready. We can have, like I said, the CT scans are cleared, the docs are there, everything is ready and waiting. If you drive yourself to the ER, if you're gonna have to park, you're gonna have to get the person in, you're gonna have to go to the desk, you're gonna have to tell them what's wrong, they're gonna have to call the doctor. The doctor's then gonna have to say what's going on. They're gonna have to get your blood pressure, they're gonna have to get blood glucose, all the things that EMS have already done. Then they're gonna have to get the doctor to get an order for the CT scan. The CT scan's gonna have to be cleared, you may have to wait. So that's millions of brain cells that are dying. So calling 911 is the most important thing that you can do for both heart attack and stroke. There's over 800,000 new or recurrent strokes every year. It's only fatal in about 10 to 20% of the cases. But thanks to recent advances like TPA, like the endovascular treatment that they can do, the survival rate has greatly improved. Now that doesn't mean that people don't have disability after stroke. About 10% of people fully recover from a stroke. 25% only have minor impairments. 40% have moderate that are manageable with some special care, adaptive equipment, walkers, braces on their legs, different things like that. And then many of them have permanent disability that affects their quality of life. So it's really important to know the signs and what to do. One of the biggest things is 80% of strokes and heart attacks are preventable. So that's the good news. So when he was talking about prevention and what you can do, these are some of the things we'll talk about that you can do to help keep yourself healthy from heart attack and stroke. There are some things, we call them non-modifiable risk factors, like age. If you, the older you get, the more chance you have of having vascular problems, trouble with your vessels, all right? We can't change our age. If we could, I'd be 46 instead of 64, but can't do that. Gender, again, males tend to have a higher incidence, I'm not having a stroke, I promise. Incidence of stroke than females. Family history, if you have family history of heart attack, stroke, any type of vascular disease like that, you have a greater risk. You can't change your family history. You can change your gender, but you are born a certain gender. These are things that we can't modify. Things that we can modify and we can help prevent are things like high blood pressure. So having your blood pressure checked regularly. If it's over 130, over 80 consistently, that is a risk factor for stroke and for heart attack, is high blood pressure, the #1 cause of both diseases. High cholesterol, get your cholesterol checked. We look at LDL levels. LDL, there's two types of lipids. There's the HDL, which is the good cholesterol, and the LDL, the loser lipids. If those are high, that can put you at risk for stroke and heart attack, because that builds up that plaque in your vessels. Diabetes is also a risk factor for stroke, so they're going to look at if you're diabetic, they're going to look at your A1C, which is how you manage your blood glucose, because as we know, our blood glucose goes up and down every day. Atrial fibrillation, which is an irregular heartbeat. It feels like a flutter, like butterflies fluttering in your chest. Atrial fibrillation can cause blood clots to form that can then go up to the brain. If you have blockages in your carotid arteries or heart disease, you can be at higher risk for stroke. Smoking, overweight, and not getting a lot of exercise. So all of these things can be managed with diet, with exercise, with good eating habits. Not smoking. Alcohol is, you can have everything in moderation, but all of these things can affect you physically and cause you to be more at risk for these types of diseases. So 80% of them are preventable. So look at what you can do to keep yourself healthy, and work with your providers, your primary care providers, your doctors, on know what your numbers are, know what your risk factors are, and how you can manage them to help keep yourself healthy. The biggest thing, rapid emergent treatment saves lives and disability. All right. So knowing the symptoms, acting quickly, that's the best thing you can do. Emergent treatment and knowing the signs. Time is of the essence for both heart attack and stroke. All right, tissue is dying. Don't wait. Call 911. 911 is the best thing you can do. Even if you're not sure it's a heart attack or a stroke, that's a medical personnel that's there that can do things that you can't do to try to determine what's going on. And they can get you to the hospital, or that person to the hospital, quicker and get treatment started much faster. And all of these things, medications, interventions, everything that we do are best if done early, all right, to save that tissue. Thank you for listening to me. I appreciate it. There's a lot of loved ones in this room that I would love it. I would hope that if they would have any type of problems, that you would know what to do. And I really appreciate the fact that you brought me here to go over this. It's really important. Again, if very few people know the signs and symptoms of stroke, heart attack, know what to do, and it's every 40 seconds this is happening. So you guys are taking the first step at making sure that you know what to do and can keep the people around you safe. So thank you very much for having me.
Thank you, Jake.
Guys, a takeaway that I see right now, I've learned more than I want to know about heart attacks, strokes, seizures all in the last few years. A piece of this, when we do our JSAs in the morning, you know, I mean, let's think about it for 1 second. Not only when you're up on that lift, how can your tool buddy, how are you going to save your tool buddy and get him out of there, or vice versa? Might need to save you or see that, hey, what do you mean you can't see out of, you know, one eye, or your arm hurts real bad all of a sudden, or you go down, or you pass out for that matter. You know, just that little extra thinking when we have that time to do the safety review before we go out on a job or climb up on a 30-foot ladder. I mean, if we just think about it a little bit, you know, everybody gets home safe every night. So that's just my one takeaway that I heard. And obviously, this stuff happens a lot more than I thought. So.
I've been on medication for 24 years, started taking when I was 30. Heart disease runs in my family. I haven't had my blood pressure is high, but it's a battle that I constantly fight. So,
But you're doing something about it.
but I take medication. I do try to exercise. But look out for, like Steve was saying, have a rescue plan in mind. Anytime you guys are in a awkward position or in a situation, always have a rescue plan. Always think about how something, worst case scenario, how am I going to get down from this platform? How are they going to rescue me? If I'm working up on a pole light in a lift, how am I going to get down? How are they going to rescue me? We always have to have a rescue plan. And if you guys need that help developing rescue plan, contact me and we could develop one together. Yeah. So look out for one another, guys. We're all brothers, and we're just trying to make it to the end. You know, from going to work and go home the same way. But make it to the end. Make it to the end. I'm talking retirement. So it's a long, long journey. It's a long journey.